So let me just state, I'm not a clinician. I work with some fantastic clinicians who know this stuff very well. So I'm not going to attempt to talk about clinical issues. What I will say is that one of the important things for HEADSPACE is for us to talk to parents about the issues that are facing their children. And what we found through our research is that parents often believe they have great conversations and great relationships with their kids. And it's quite interesting, we just finished a piece of market research where we talked to the parents and then we talked to their kids. And the kids said, we don't talk to our parents about our mental health issues. In fact, my father would tell me that I'm an idiot and mental health doesn't exist. That sort of response, there was a huge disconnect. So one of the things that we're working on and the clinicians have been helping my team with is actually helping parents identify what some of those issues are, and not taking a young man, for example, who's locking himself away in a bedroom as being the norm, as normal teenage behaviour. And that's one of the things we hear all the time is that, and I'm a parent of 3 kids, and I get all the time, wait till your kids turn 15, they'll stop talking to you. And so one of the things that we're very interested about is this relationship between parents and young people, and the assumption of parents that there's a period of time that young people go through, that they actually stop communicating, that they get sad, sullen, depressed, they don't talk, and that's normal. Now, it may well be in many cases that's true, but in a lot of cases, and we're talking, 1 in 4 young people, and in fact that's probably an underestimation, are actually experiencing quite severe issues ranging from, could be bullying or self-esteem issues, depression, anxiety, stress, particularly at transitional points in their life. What we mean by transitional points is going from primary school to high school. That's a very significant point in time in a young person's life. The transition from high school to tertiary education, and leaving home and finding work. These are the 3 main points that we find in HEADSPACE that we have people come to us about. And they're times, just if you remember what it was like when you were 12 or 15, I mean, it's a very long time ago for me, but remembering those top points of time in your life and the stresses that you go under, and they actually align with those points in time where parents say their kids have locked themselves away in their bedrooms. So I'm talking more about that relationship basis, and I'm sure there's some other people here who can talk a bit more about the clinical side of things.
And like Elisabeth, I also catch this by saying I'm also not a clinician, but from my own experience with Lantern, from our experience with Blossom Project, and from my experience as a mother of 3 who are now range in age from 19 through to 25, I would say that instinct as a parent, as a friend, and a family member is what you need to rely on. And we sometimes fail to trust our instinct. I think if your instincts are telling you something's not right, then you need to act on that. Even if it is to seek some sort of professional reassurance that you needn't worry. But it's very important to actually trust your instincts. And when you notice something, you're usually noticing it for a reason. And I think the key take-home message is look for change. Look for something that might have changed, and to trust your instincts as well. And don't sit alone with it. There's often a lot of hesitancy because there's still a lot of stigma, unfortunately, around mental illness and mental health issues. You've all got a sheet of paper on your chairs, and that shows you quite clearly this is an issue relevant to your young people, to the young people in your lives. So do not be afraid to talk about it, because the more of us who do talk about it, the easier it becomes as a community.
Yeah, I guess I would echo both the thoughts shared already. One of the ways we tend to look at it is this a young person who's leaning into life or leaning away from life? If you think about that for a moment, when we lean into life, we're engaged, we're interested, we're connecting with people. Might not be talking to mum and dad, but we're talking to other people. Whereas when we're leaning away from life, we are tending to lock ourselves away, to isolate ourselves, to lose interest in things, even to the point of the basics of how our bodies function, the amount of sleep we're getting, are we eating regularly, what are we eating regularly, are we sleeping? So these are, for me, the real indicator, and what we often train our young people at Reach to look for is this somebody leaning into life, or are they leaning away from it? And I think that's a useful visual as a parent, and I'm one as well, to be able to sort of monitor your kids. The other one is the unusual behaviour. Behaviour starts to shift, not just for a day or two, but for a week or two, and something might be going on there. And finding a way to get help is normally the biggest challenge, because to the point made, often the kids won't want to talk to you about what's going on for them, and you feel left out and locked away. And that's again where some of the great services represented here, and services like Lifeline, probably the biggest piece is finding them someone to talk to, and somebody that they want to talk to if that's not you. So helping them make that connection, even if they're not going to speak to you, is often the best thing that you can do.
I'd agree entirely. It's very difficult to go last because it's more or less been covered, but I'd agree entirely with the comments that have been made. I have a 17-year-old, a 15-year-old and an 11-year-old in my care, and what we look out for as parents is is changes in behaviour, and as you rightly said, trust your instincts, and let them know that you love them as often as you can, particularly in the vulnerable age group of 14, 15. When you're going through those significant life changes. But I'd also say, as a parent, don't be afraid to to stick your hand up and seek help yourselves. I mean, there are services. Many services available. Lifeline is just one of them, where you can actually talk to someone and get some perspective on your situation. I know that NAB would have a very good employee assistance program. Don't hesitate to make an appointment with a counsellor and talk to them about your concerns for for your child. And I just encourage not to ignore it. Particularly if you're very concerned about what your child or someone in your care might be saying. Leaning away from life, talking about, not wanting to be alive anymore, those sort of things. Those kind of comments need to be taken very seriously. Again, just put your hand up and seek some advice elsewhere if you don't have the answers, and most of us don't.
It's on now. It's on. Usually I don't need a microphone. So. That's what my kids say anyway. I just want to add to that this piece of research that we did was actually quite an eye-opener for me personally. The one thing that came through was parents expected to be the one with the answers. They expected to be, and that we're talking about parents who do have good relationships with their kids. So we're not talking about parents who are disengaged, not interested, and I'm sure none of you are like that. We're talking about parents who actually know what the kids are doing, who are interested in their life, who love their kids, to death basically. They want to do the right thing for them, but they also think they have to have all the answers, and that's not true, because whilst most of the referrals we get to the HEADSPACE are through family and friends and GP, so parents are referring kids to HEADSPACE, there's a lot that aren't referred to HEADSPACE through that normal network. They come through their own volition. And the one thing that we want to be saying to parents is, do not be afraid to be the person who is not the one your child goes to. It is not a reflection on you, it's not a reflection on you as a parent or your abilities or anything like that, but sometimes a young person will feel more comfortable talking to somebody else before they come to you. And the other thing I'll say is, if they do come to you, that first point of contact, that first conversation you have with them is the most pivotal conversation you can have, because if they get a negative reaction from you, it could be you're on your iPhone and you're answering emails from work, you're washing up, you're watching the footy, whatever it may be, or you say, just buck up, you'll get over it, they won't come to you again.
Actually, just to support what Elisabeth said then, I think it can be, those first conversations that happen can be scary and confronting for you. The best thing you can do, one of the most powerful things any of us can do, is to listen. And you don't, Elisabeth's right, you don't have to always have all the answers, because there is a lot of information out there and a lot of very, very good quality information. So you can always go away and do some more research and ring people, seek support through your staff counselling programs and other things. But listen. Sometimes as a parent, one of the hardest things personally has been you want to fix things, isn't that what being a parent is, that you should be able to fix it. The hardest thing to do sometimes is actually just to listen and to hear what they're saying, and then to take a moment to work out what the next strategy should be, rather than being reactive, which is a natural thing for us to happen because it's often quite scary and we want to do something to make it better.